Hey, Dr. Jerry Williams here today with Urgent Care 24/7. I want to talk to you a little bit about a particular illness that is related to mosquito bites. And you may be thinking, oh, he's going to talk about malaria. Well, no, actually, malaria, fortunately, is unheard of in the United States unless you've been traveling to malaria endemic areas. But we're going to talk about West Nile virus today, because West Nile virus is actually present throughout most of the U.S., actually. And since things are warming up and mosquitoes are there's a larger population of mosquitoes as the weather gets warmer, it's a timely topic for us to chat about. Now, fortunately, most people who get West Nile virus infections, they do not become symptomatic. In fact, about 1% of the people who get West Nile will actually get sick, really sick. About 1 in 5 patients who get West Nile will have some symptoms, but only about 1% of all West Nile virus cases get a fever and get significantly ill. And then, interestingly enough, only about 10% of those patients require hospitalization and have serious illness. So the overwhelming majority of patients that get West Nile virus, the good news is, aren't going to have a problem. Now, who is at most risk for developing serious disease of West Nile virus? Patients over 60 years of age and patients with other comorbid conditions like diabetes or any kind of immune deficiencies or recent chemotherapy from cancer, such as that. So if you're a healthy person, typically you're going to be able to fight off West Nile virus pretty well. But if you have a comorbid condition, you need to be a little bit more careful. What are the symptoms from West Nile virus? Well, you can get headache, malaise, stiff neck. It's the symptoms that go along with encephalitis or meningitis. There can be seizures, coma, in severe cases, seizures, coma, mental status changes, and of course, even sadly enough, death. But fortunately, that's a very, very rare population. But since West Nile virus is endemic in all of the United States, and it's important to at least be thinking about this illness if you or a loved one or a friend has these kinds of symptoms as we warm up and there's more mosquitoes and we're spending more time outside in the pretty weather. Just something to think about. So West Nile virus, now you know a little bit about it. If you have any symptoms like that and you have a history of mosquito bite, which, shoot, who doesn't get mosquito bites this time of year when things are warming up and you're outside? So if you have any of these symptom complex that I've described, be sure to seek out care with your primary care doctor or in a local urgent care emergency room. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.